Hey, everybody. Welcome to another episode of the Horse Geeks podcast, where we look at horses and riders from the inside out. I'm Kirsten Nelsen, professional horse trainer, and with me is Deb Romero, my good friend and certified Alexander technique instructor. So today's topic is about head neck balance. And I think you can talk about it extensively in your work, Deb, because it's one of the first things that Alexander technique really addresses very specifically. And when it comes to horses, we're encouraged into traditional training to frame the head and neck, develop a head
Mm,
and neck set. And we've talked
mm,
about devices we use for that with horse training. But even if we're not using a head setting device or a leveraged bit, just the force of the rider's reins is in order to quote unquote collect the horse or put the horse in a frame, everybody starts with the head and neck. So,
that's just as mind-boggling to me because
yeah,
we think it, and I hear this from people all the time, whether they're riders or non-riders, is that it has to be a certain place. So you hear the language, is this right? Is this is this how I get there? Just give me A, B, C so it equals the answer. And that's really not how the body works. It just you can't say to do it this way and you're always going to get this answer.
especially for multiple bodies.
Yeah, yeah. And like I mentioned in the last podcast, even though, as an Alexander teacher, we're trained to start with the head neck relationship because usually if you can free up the head and neck relationship, it affects the entire spine. But maybe that's not an option for that person. You might have to go somewhere else. And the same thing I would think with a horse.
Yeah, so like with the horses, I just wanted to kind of point out this quick comparison because horses are quadrupeds with a very long neck and a heavy head. The horse's head weighs about 1/10 of their body weight. So 1,000-pound horse has a 100-pound head. That's a big, heavy weight on the end of that long lever that doesn't have a leg under it,
Right.
right? So the movement of the horse is always generated by the thrust of the hind legs, travels through the barrel, through the front legs, out through the head and neck. But we're taught to collect a horse by starting with the head and neck. That's why so many horses get crooked or lose forward, because we're kind of creating a dam in the river of energy that the
I'll
horse,
flow.
the
Hmm.
direction the horse is supposed to flow. And so the main difference between the human body and the horse's body when it comes to head neck relationship or head neck balance is in humans, we don't use our head and neck as a balancing mechanism or as a stabilizing mechanism. A horse does. And what I mean by that is if we lose our balance, like imagine a tight
Hmm.
rope walker, or even elderly people, if you're losing your balance, what do? We reach out with our arms,
Right.
right? So we use our arms as sort of a stabilizing mechanism when our axial skeleton or our midline becomes unstable in the relationship to gravity. Horses' front legs, the anatomical equivalent of our arms on a horse is their front legs, right? Then they have
Hmm.
this long neck and heavy head. So they don't lift their front legs off the ground and try to stabilize.
Right.
What they do is they use their neck and head the same way the human uses their arms. So, in other words, they need freedom to adjust that head and neck position. If they lose their balance in the middle of their torso or through their axial skeleton, they move their head and neck up, down, in, out, left, right to sort of stabilize their whole
Hmm.
body while they're losing their balance more in the middle of the forelegs. And so that's a huge difference that I think humans sometimes don't understand because if we restricted our head and neck, it's not going to massively throw us out of balance. But if we restrict the horse's head and neck, it would be the equivalent to taking a rope and strapping down the human's arms and saying, okay, now learn to walk on the balance beam.
So maybe we could explore what restricting kind of means. I'm trying to wrap that around in my head because there's so many people. We've talked about rein contact and rein aid. Maybe that's part of it. Because what I see when I look at picture after picture of especially English riders is there's always this backward looking, the arms are kind of moving towards the person looking picture, as opposed to just having a contact where the arm is neutral and not in a contracting way. Does that make sense?
Yeah. So basically, what you're saying is some riders look like water skiers.
Yeah, that's a good way to put it.
Yeah, that's kind of how I could keep it simple. Yeah, because sometimes the torso is leaning back and the arms are sort of pulling into the torso, and that is the direction of force, right? So
Right.
when we shorten our arms, even if we only shorten our arm muscles, we've talked about concentric, eccentric muscle contractions. That shortening of the muscle fibers and the leaning back of the torso generates a force in our bodies that goes directly against the forward
Mm-hmm.
flow of energy that's coming from the hindquarters. So it's actually like we expect the horse's energy to flow forward like the boat, and we leverage back like a water skier.
Yeah.
And that sort of counterbalance does create some stability. That's why it perpetuates,
Well, that's good. That's a good point. It creates a type of stability, but
not balance.
it's not balanced. And I've been reading lately that there's actually some bony changes in the cervicals of the horse that are happening from that type of leveraged control.
Yes. So let me go over sort of the thing you said earlier, like comparing the use of the horse's head and neck to a human's arms. It would be like telling a gymnast that your arms should be 30 degrees off of your sides and bent this much and no more and no less, no matter what you're doing.
Yeah.
And that's, by the way, that's how you're going to learn to walk the balance beam and learn to do the tumble. Your arms stay here no matter what. And we're going to use some duct tape and some Velcro and maybe even something sharp and pointy so you don't forget this is where your arms
Oh,
belong, right? And you can't imagine doing that to a human that's learning how to balance or learning to be athletic. The
right.
arms are the last thing that fall into place because we need them for stabilizing in the process of learning to balance. But
Hmm.
that's exactly what we're doing to the horse's head and neck, is we're saying your head belongs here and should not move while you figure out your balance through your torso and your forelegs.
I think you'd agree with me. I know just with the few horses that I've rehabbed that have been ridden that way, they don't know what self-carriage is. They fall all over the place when you allow them the freedom of no leverage.
Yeah, they stumble. They
They
don't know where to
stumbled.
put
It's a
their head
very
and neck.
scary ride at the beginning.
Yeah. No, when I took an ex dressage horse that was given to me and he had gone to pre-St. George level. So you would expect his balance would be very good, but he got given to me because he had navicular and ring bone. So he was devalued, but he was quite young still. So I took him as a rehab project. And if I literally did not do that water skiing thing, right, which is lean back against the forward and let him
Mhm.
literally prop on the bit like it's a walker, like basically holding the
That's a
front
good
end
point.
up, he would go faster and faster. And I go, okay, let's explore that. And he would get into trot and he had no idea. He had no self-control over his own movement. And what was scary was I thought we were going to do a somersault a couple of times.
Yeah, it's
He
very
was
scary.
all of his energy was going really fast forward, but down. He kept
Oh,
searching for me to hold him up with the
for
bit
balance. Yeah,
for
yeah.
stability, not even for balance, just for stability. And when I took that away and I wouldn't give him strong rein pressure, I thought at the trot, and the canter was even worse, but I thought
I
at the
bet.
trot, the canter, we were bucking and bolting and out of control. And I went, okay, we'll wait on that. But at the trot, we just kept going like a waterfall, not even a river. It was like a
It's just
waterfall.
nonstop.
And I thought, we're going to like flip. And
Hmm.
so it took quite a lot of work to rebuild his ability to control his own speed and balance, because
That's a good
that's,
point because that happens in people. We don't take the time that it takes to, we think, we're taught, especially as Americans, that, oh, take this pill and it'll go away, or seek the doctor and the doctor's going to fix it. When for me, as an Alexander teacher and every other modality I'm trained in, it's all within the human body.
yes.
It's all available. It's just layers and layers of getting rid of bad habits and
Yeah. And
allowing new habits to form. And this horse was, the same thing. It's going to take him, it's not only, involves everything, psychologically, emotionally, the body itself, reorganizing neurotransmitters, making new synapses,
new neural
just a whole
pathways.
new neural pathways. And the same thing with people. There's no gadget that's going to fix it.
No, I go when it's actually authentic and dynamic and truly a change, a lifelong change in habits of motion. It's like you can't get that tree to grow any faster than it's going to grow.
Exactly.
No matter if you give it too much water, you kill it. If you give it too much fertilizer, you kill it.
You
It
kill it.
just, it's like it's like watching a tree grow. It can't be forced. It
Yeah.
just has its own time and evolution, and it needs to be supported with water or fertilizer or the right environment, but you can't make it grow any faster than it's going to grow
Yeah.
if it's authentic. And then I want to get back to what you started to talk about. The neck arthritis in horses has really become a
Hmm.
much more
Big deal.
pervasive problem
Hmm.
than it's ever been before. And I haven't done any research or seen any research done on it, but my guts tell me there's a direct relationship between the size of the thigh blocks on saddles, which give the rider a lot more leverage on the reins because it's holding our legs in
I didn't even
place.
think of that. Oh, wow.
But these big, deep saddles with massive thigh blocks are giving the riders an
More
incredible amount of
leverage.
leverage, even if you have a
Wow.
snaffle bit.
I didn't even think of that.
Yeah, and the
That's
prevalence,
huge.
I think there's a direct correlation between the increased incidence of neck arthritis and either the increase of leverage on the bit and or the increase of the thigh blocks on the saddle
Wow.
or the depth of the saddle. When the saddle is like a wheelchair that just holds the rider in place no matter what they do, you have a massive amount of leverage on the reins because it stabilizes the rider's lower body.
Mm. And I saw, where did I see this? I was on Facebook this morning and somebody had just gotten in a slew of new Western saddles, and they were showing pictures of them in their tack room, and there were little tiny thigh blocks on the Western saddle.
Hmm.
I was, oh my God,
Yeah, those were
not
common.
not in the Western world too.
Well, they were most common in the Western world on what you call buckaroo style saddles, which
Is
are
that what they
made,
are? Okay.
yeah, in buckaroo style saddles, you could get these little sort of cushion things that you would put
I just
like
couldn't.
thigh
I've never
blocks.
seen it before.
That's the only time I've seen it. And it was for people who are riding, like if you look at a bronc saddle in a rodeo,
Mm-hmm.
It's basically a strap and thigh blocks.
Right.
That's
That's
all it
true.
kind of is, right? So the thigh blocks are there to really leverage the rider's ability to use the legs to stay on the horse
Wow.
or stay in the saddle. But what that indirectly does is also massively increase rein leverage.
I didn't think of that relationship. That's true.
Hmm. And you had a horse that congenitally had neck issues. Like she wouldn't allow you to crank her neck in, or you are not staying on.
Exactly.
It's like if you tried to use bit leverage on your big mare, you're getting a flying lesson,
Yep.
not a riding lesson.
Exactly.
And so that was probably something she was born with and had a congenital issue. But how did I remember being with you when we were trying to figure out that
Mm-hmm.
intermittent lameness.
It was weird, wasn't it?
Yeah.
Because nobody believed me.
So talk about that a little bit, how it manifested and what we found out from that.
It manifested as like an abscess type lameness. Just all of a sudden, three-legged lame, always on the same leg, had tons of exams, and it would come and go. It was intermittent. And I think I talked to you about it for 6 months to a year. And it finally happened when I brought her down to stay with you for the winter. And, we
And
finally, that's the funny thing. We're looking at the lameness as being a leg problem.
issue.
Yeah, we always think of it as a leg problem. We were lucky enough to have a great vet down there in Florida that did the exam, and you were up at the ring, and she came up and she says, I think it's in her neck. And you and I both looked at each other and went, oh, that makes sense.
Yeah. It was like
It
instantly.
was instant. We were like, wow, why didn't we think of that? Because she was always in extension.
Yes.
She was always in flight mode.
And not only that, but people would describe her like I've had people describe, my horse hates the bit. My horse hates rein contact, right? And yet, a lot of our traditional instruction, if we want to improve the movement, is you start by shortening the reins. You start with bit leverage, right? So you resist them putting their head up or out or down too far. And your mare was like not having it,
Mm-mm,
right? And so to find out that there was a neck issue through the vet,
mm-hmm.
and then the recommendation for that, sure enough, when they did the x-rays, what did they find specifically? I know it was a couple of cervical
There were
vertebra.
stenosis and bone spurs in like C6, 7.
Yeah, I thought it was even
Yeah.
5, 6, and 7.
Yeah, mine have been 5, 6, 7, something like that.
So it was the lower neck,
Very
uh,
deep lower neck. Yep.
which was probably impinging a nerve, which is why she
Mm-hmm.
would go intermittently lame on the left front. And it
Mm-hmm.
did. It looked like it was a hoof abscess, or
Mm-hmm.
maybe she had arthritis in her knee or the carpus on the left
Mm-hmm.
front, or that it was maybe a fetlock issue or even a pastern, like it could have been ring bone, side bone. And I think they blocked the leg and did x-rays and found nothing.
Nothing.
And that's where the vet said, well, on another visit, maybe we want to check the neck. And we're like, it's the neck.
It's the neck.
It's the neck. And sure enough, they found, you
Yeah.
said bone spurs and stenosis, which is just
Stenosis.
neck arthritis or spinal
Mm-hmm.
arthritis. And so the recommendation, of course, from the vet was,
Injections.
yeah, steroid injections. And again, you're risking anytime you're poking a needle in a joint. And having had several injuries myself and arthritis, it's like I've had injections and they did nothing for the pain. Absolutely nothing. And so what did you opt to do? Because it was interesting.
What did I opt to do? I think this was our exploration. Um, because it was Jean-Luc Cornille was there too, and he said, you either figure this out or you're going to have to euthanize this horse.
Hmm.
And that just sent both of us down this pathway of what do we got to do? You know, what did we got to do to help her figure this out? And, you know, she, knock on wood, I don't, how long ago was that? I'm trying to
It was a
remember.
couple years ago now, at
At
least like
least
5 or 6 years ago
five or
now.
six, I'm thinking. Yeah.
Yeah.
And I don't think in the last 4 years she's taken a lame step.
Yeah, the lameness cleared up pretty quickly.
Hmm.
But she was an interesting case, just like my dressage horse that I took on, who had ring bone and navicular changes on the front right hoof.
Hmm.
Even like I had to develop the balance like you did with your
Hmm.
horse through the back and hindquarter
Yes.
without ever
No
touching
reins.
the reins.
No reins.
No bit leverage, no rein leverage. I could use the reins
Mm-mm.
independently left to right. So I
To
only
turn.
ever
Yeah.
only
Hmm.
ever worked in a snaffle. But you had to be far more creative to build up the back strength, the hindquarter engagement, and the strength of the hindquarters. And in that process, you saw, like I saw, my horse kept trying to overcurl his neck to find that stability on the bit, even if
Even
I
with no
wasn't
contact. Yeah.
no
That just
contact.
blew my mind.
Yeah, he did that for years until his back and hindquarter got stable enough that he could quit over curling his neck. So all of his rehab work was done with very light pressure on the left rein only or the right rein only, but never two at a time,
Yeah.
ever.
And with my mare, I had, and she came out this way because I bred this mare. She came out in extension with a high head. And years, like you said, years of teaching her that is not the answer.
No, and part of how you knew it was congenital was number one, you raised her from a baby and you had
Hmm.
never leveraged her mouth. You had
Never.
never done anything like that. And two, her sire had the
Hmm.
same
Hmm.
hatred of bits and reins, and he was quite a tricky horse to ride
He
as
was,
well.
well, that's because they were trying to leverage him and
Wasn't having it.
he was airs above the ground.
Yeah, yeah.
I didn't have any problems with that stallion, but when he was pressured and put into the 100-day test as a 3-year-old,
Where he had to look collected.
yeah, and
Mhm.
then just being a stallion, micromanaged and shown campaigning, he just lost it. And
Yeah,
he just
and
said,
that's
I can't do this anymore.
what I find too is horses that sort of get labeled as hating rein contact or hating the bit. A lot of times there's a physical reason.
Mhm.
And I think like with your mare, um, it could have just been a congenital issue
Right.
with either the formation of the cervical spine or the inherent coordination of how they just moved. And in my case with my dressage horse, he was sort of leveraged into that neck use.
Hmm.
Good because it wasn't a natural one. And he
Not
kept
at all.
yeah, and he kept looking to really seek his stability through the bit and his neck. And it was completely foreign to him that there was any other way to control his movement, which is
Mhm.
kind of a man-made problem. That's not a
Yeah, I
normal
agree.
horse problem. And I never x-rayed his neck, but I'm sure he's riddled with arthritis. And he was lame. He would go lame. The other reason I knew he probably had neck arthritis is he did a similar thing to your mare, that even though the pathology was on his right front hoof,
Hmm.
more often than not, he would go from sound in general or be sound on the right front and lame on the left front.
Interesting.
But there was no pathology in the left front. And I go, that's probably more related to the neck issue.
Hmm. Yeah,
And
it's
and
kind of like thoracic outlet syndrome in people. You know, all the nerves run down your neck and they go under your clavicle that go out to the arm. And if for some reason the way you use your head and neck, if you're not balancing it properly, you're pinching against the bone, those nerves, and that causes the thoracic outlet syndrome and the numbing and the pain down the arm. And I was thinking that's probably what my big mare had going on. It was, that was the way I could compare. And it was a use problem. It wasn't and a congenital, but to teach her to use herself better. And I see her doing it even out in the pastures now too, that and it really changed her personality too once she got out of that
Out of the
being
pain.
yeah, out of
Hmm.
pain. And people, I think, do the same thing when you have a trauma or a pain mechanism going on, you anticipate it.
And you
You and
protect it.
Yeah, it's very powerful.
Very powerful. No, and I watched her change, I think, and I've seen it in my own horse, that once he learned he could stabilize his movement with a long, free neck, I see him play with it in the
Yeah,
pasture.
yeah,
And I
it's
had to,
quite cool.
it's really cool. And I watched your mare do it sort of going down a hill, how
Mhm.
slowly and carefully she engaged her hindquarter and would go down the hill just for fun
Yep,
because it
just
probably brought relief to her neck.
mhm,
But it was so, and then again, both horses, their personality totally changed from
totally changed.
cranky or crazy into sort of calm and thoughtful because
Yeah,
the discomfort, even if it isn't to the level we would call pain, which for your horse and my horse, it did go there, but as they're backing off of what's causing the pain, with or without pathology, I think that's the important
right,
part,
that's important. Mhm,
right? So you don't necessarily have to see anything bad on the x-ray to have a pain issue.
exactly.
And I don't think people understand that there can be pain long before there's pathology. And that pathology that we can see on an x-ray or an MRI or a scan. And that
Mhm.
injecting the pathology doesn't necessarily address where the pain's coming from.
Yeah, because we as humans wanna see things in isolation. It was like somebody posted a picture for me on and said, "Is the rider biomechanics off and or is it the horse?" And it was a still picture, and I said, "Well, I really can't answer to that because I have to have movement
Oh, no, I could
to."
answer that.
Well, I mean, I could, but I wanted to see what was the relationship between the horse and the rider when they were moving. I
But
mean,
if
what
you even see it in a still picture, if the rider has lost the integrity of a straight line of force between their seat bones and head, or if the rider's center of mass is not over their feet, then it's a yes answer. Yes, the horse and rider have a
mhm.
balance issue.
Well, see, what they wanted to do is compartmentalize it and say it was either the horse or the rider. And I'm saying it doesn't work that way. They affect each other. Those forces affect each other.
They affect each other, but the way you know the balance issue is with the horse and not the rider is, and we see it with surfing big waves or going down steep mountains. Some people can do that. Some people can stay on a bucking horse or a galloping
Hmm.
horse or a race horse or a rearing horse because they know how to balance their body in relationship to gravity, not
Right.
have to control the horse. So in a still picture, if I see the rider's unbalanced and the horse is unbalanced, I don't know. That's chicken and egg. I don't know who started that deal, but
Right.
it's
That's what
affecting
I,
both of them.
yeah. And that's what it can't be put into isolation,
Yeah.
like
I don't know who
saying,
started it, but I know they're both out of balance.
yeah, yeah. I said, it's like most of my great teachers, I've presented to them case studies after case studies, and you ask them, well, how do I ABC this through this and fix this? And most of my best mentors say, well, it depends.
Yeah.
There is no rote answer to these equations.
No, because if I come upon an unbalanced rider on an unbalanced horse, I'm looking for where's the path of least resistance to get
Yes,
this turned around. And sometimes it means we have to address the horse's issues first, and
right,
sometimes it means we have to address the rider's balance first.
right.
right? But ultimately, I think what I'm talking about is even though an unbalanced horse is really hard to ride, it's possible for the rider to remain in balance on an unbalanced horse. And that's actually the key to helping the horse find
I
balance.
agree.
But because the rider's relationship is with gravity, not the horse.
Right.
So
But
that's why it's possible, but it's not very frequent. Like it's the odds are kind of stacked against us to figure that out on our own.
yeah.
So when the horse loses balance, most riders lose balance with the horse.
Well, and it goes with a lot of the language we've been taught, you know, ride the go with the horse's movement for one.
Yeah, if it's unbalanced movement, that just adds more force to the imbalance, to the problem. And it's interesting to note too, if I took a really well-balanced horse, well-muscled in self-carriage, what we would call a schoolmaster, but if I put an unstable, unbalanced human
Mhm,
on that horse, it could take as little as a few rides
mhm.
or a couple of weeks or a month. Maximum, you got 6 to 12 months before that horse completely loses balance from the imbalance of the rider because
Yeah,
we are a weight and mass straddling their torso in motion. So we have a bigger effect on their motion than they really have on our ability to balance. So the rider can
right.
stay balanced on any type of movement, but a horse can't maintain balance with any kind of rider, no matter how well they're trained.
Exactly.
So that's mainly the difference. But I want to hear you talk a little bit more about sort of where you started with like how the use of the head and neck can influence pain issues in the arm or the chest or the back or even the feet. That's why it's an important part of Alexander technique. That eventually, if we don't have good balance between our skull and our cervical spine, that can throw off the balance in our bodies. But you might go to the person's low back
Mhm.
or leg use or pelvic use or upper back use to free the neck and head, to change the balance
Right.
of the neck and head.
Right.
And
Right.
that's more how it works with horses,
Yeah, I like what you said, you seek the path of least resistance. You know,
always.
I am not going to spend 45 minutes trying to clarify to somebody the head neck relationship if that's not where their understanding is at that time.
Yeah, it would be like you and I thinking the only way our horses would ever improve balance is if we started by framing up the head and neck.
Right.
Never, never going to happen. My horse had a corrupted relationship with
Mhm.
that, and your horse had a level of discomfort that she wouldn't allow it without giving you a flying lesson.
Yeah. And my other mare has got had that totally corrupted relationship with rein contact,
The overcurling of the
the
neck.
over curling of the
Mhm.
neck, and that took just as long.
It was hard to ride.
Very hard to ride and hard to unwind all of that. Now, she's in a great place, but my neighbors probably think I'm crazy the way I ride. So,
Yeah, because people, a lot of times, if we're very steeped in traditional training, especially English, but I
mhm,
think one of the things that opened my eyes was I saw very well balanced horses with cowboys, very powerful.
mhm,
And when you're training or bringing a horse up in a Western version of training, when they're young, you have a very light contact on two
right.
reins, on a snaffle only, right? And you move to one-handed riding on a loose rein, the more advanced the horse becomes. But it's like there's a whole world of riders out there that aren't using leverage on the reins to balance their horse. So why do we think that's the only way to do it if we're an English rider?
Yeah. I think I don't know how we've gotten so dysfunctional in that category. Um,
Yeah, because I can be just as light and loose with my English snaffle and set of reins And still, especially on the type of horses we're describing that have a corrupted use of the neck or possibly arthritis or a pain issue in the neck, you can't use rein resistance hardly at all in the process of developing engagement, lifting the back, building muscle, building balance
Right.
and agility. But it's entirely possible. And I find now the horses go through the training and development faster if I don't use a lot of rein pressure and if I don't use leverage bits. And I allow them that ability to adjust
Mm.
their head and neck pretty freely. I go,
Yeah.
that ability to
Mhm.
adjust their head and neck actually speeds up the process
Yes.
of shifting the stability from the front end to the hindquarters where it belongs.
Yeah, it's kind of like my work. It's not a therapy, it's a teaching tool. I'm not saying you have to do it this way. This is the only way to do it. It's an exploration. And I think that's so important to allow the flow of allowing the horse to participate and have a point of view about movement. It just once they figure out, oh, they're giving me permission to seek my own balance and
Yeah,
they're trying to help me seek my own balance, then it just snowballs and gets even better and better and better.
yeah,
And that happens with people too with the Alexander work. It just gets it's just layers of teaching tools put on top of each other that you can use throughout your life. And it's documented proof that Alexander lessons actually give people with low back pain longer time with no back pain because it's a teaching tool. It's not being done to them. We're
right.
just giving you suggestions of how you could change. And it's up to you to change. And once people and horses are given permission to seek change within themselves, that's when it gets juicy.
Yeah. And I think with every rehab horse I've worked with, young horses not so much, but particularly in rehab, there's that moment where the horse goes, it's okay to make
Yeah,
mistakes.
I can do this.
I
You're
can make a
allowing me.
mistake, or I can explore, or I can
And
have an opinion.
that's a
And
whole human thing that we have to get over.
yeah, but like you and I, who are kind of obsessive and geeky about doing research and understanding the functions of the mechanical body and the forces of motion, it's like the more you learn, the more you understand. It's so complex.
Mhm.
There is no way anybody on this planet is going to push and pull a horse into balance better than the horse can find their own balance. And it's like trying
Yeah.
to leverage somebody, like I'm going to strap your hands to the handles of a bicycle and I'm going to use
Hmm.
a whip to drive you forward and you're going to learn how to ride a bike.
Right.
And I go, maybe the odds are not really in your favor because you're probably going to struggle. You can't adjust your hands and somebody's driving you forward. So you almost don't have time to think about finding your own coordination.
Mm.
And true self-carriage, true authentic mechanical optimal coordination in the horse's movement has to be self-discovered by the horse. There's no way a human can do that
Yes.
to a horse. All we can do
I
is
agree.
guide.
And that's pretty much what the Alexander work is. And I think a big part of the Alexander work and as a rider is we have to be using ourselves well so that the horse giving the horse permission to be in a safe situation with the rider on top. I have to work on my rider balance so that the horse can work on their balance.
The rider's body and the rider's balance is actually singularly 90% of how you help a horse find balance. It's that important. It's that impactful.
Thank you for saying that because I've believed that forever. But
Yeah, because
it's not
how
manipulating and leveraging the horse. It's It's
No,
all
it,
about how I use my body. And I think that's what makes it easier for me is because of all the training I've had.
yes, because
Yeah.
all you're doing is that efficiency and optimization of your
Hmm.
internal coordination that you found off the horse through the Alexander technique. You're doing exactly the same thing, but now you're navigating that balance with gravity while your feet are off the ground
Hmm.
and you're straddling this always changing, unpredictable river of force. And you're having to find your balance in the context of like a moving body of water
Hmm.
that's unpredictable, always changing and developing, but it's possible we can do that.
Yes.
So the rider balance, when we maintain our integrity as a rider in the saddle, that actually has the larger influence if we look at it from the perspective of laws of motion or physics.
Hmm.
Our mass and weight is primarily our torso. So that mass and weight impacting in the saddle is far more influential than anything we can do with the reins.
I agree.
And when we start framing a horse or asking for collection with the reins and a headset, we usually aren't even aware of what's going on with our seat and our torso.
Hmm.
And the idea was drive the horse energetically forward into the wall of the bit. And I
That
go,
sounds fun.
well, that's sort of the idea of how you get lift. And it's not entirely wrong. It's only 95% wrong. But it gives us the image. It gives us the image of like, we need this leverage to balance the
Right.
horse, that a horse can't do it. And I go, that's not true. The horse can do it perfectly fine.
Hmm. Just get out of their way.
Yeah. And look at the beautiful movement that foals pull out all the time.
Yeah.
They have no muscle. They're not all that well balanced. And yet they have this incredible movement while they're out there dancing around being foals.
Yes.
And they wipe out. They also lose
And
their
it's
balance.
okay. And they get up and they're like, okay,
Yes.
cool.
And horses wipe out. They misjudge, wipe out. So I go, a falling over in a horse is a pretty severe loss of balance,
Hmm.
right? Long before they actually lose balance by falling or stumbling, they've already lost a great deal of mechanical coordination.
Yes.
Yeah. But it definitely, we do not have to, your horse, my horse, many horses. I go, I'm just not a big fan of heavy leveraged bits and heavy rein contact anymore because I find it slows down progress. It doesn't speed up progress, it slows it down.
And it can cause debilitation, you
It
know?
really can. You're risking a delicate, mobile part of the
Hmm.
horse's spine is the cervical vertebra. And so you're risking nerve impingements, arthritis or stenosis,
Bone
bone
changes.
spurs, bony changes, and that will, if that happens in the horse's neck. Like I had a horse that had a hairline fracture all the way up at C2, which is right up behind the ears at the
Mm.
top of the neck. And that actually directly affected his self-control over his hindquarters.
Well, that makes sense.
Yeah. So C1 and C2, if you get arthritis up there, they can't stabilize the hindquarters, right? And as this fracture started to callus, he literally started falling over and could not get up.
Wow.
That was the nerve impingement on the spinal
Hmm.
cord, way, way, way up there at the top of the neck. Meant he couldn't get his hind legs under him to get up and he would fall. He was very unstable. So he would fall. And it took like a whomping amount of steroids for him to get back up.
Oh.
And that went on for a few months and then he just couldn't get up. And it was sad because he was still alert. He was still eating. It was just that nerve impingement on the spinal
Hmm.
cord way at the top of the neck was totally debilitating to his control over his hindquarters. So it's when we monkey around with the neck, it's a much bigger deal than I think we realize.
And it's not only just in riding, it's in other equipment, side reins, and, think all of that. used to frame the horse.
Yeah, whether it's groundworking devices
Right.
or leverage devices we ride with, or even a backwards lean, a backwards pull,
Hmm.
a heavy rein, especially if you're leveraged with thigh blocks. It's like that's a lot of force acting against the
Yes.
freedom of use in the horse's neck. Yeah. So I think it's an important topic to talk about because I still mostly see riders at all levels because I think the human eye can see where the head and neck are more obviously than anything else. We want that to be in the right position because we can see it.
Right. We're very visual.
Yeah.
We gravitate to the visual image
Yeah.
instead of what's going on internally.
Yeah. So we can see leg movement and we can see head and neck position. And a lot of times that's what we're basing quote unquote good movement on. But I go, the only way we know if we have good movement is through the feel of the ride,
Yeah,
not what it looks like, it's what it feels like.
exactly.
And the head and neck can be adjusting, but the back and hindquarters building stability is a much easier ride.
Yeah,
It's a much more pleasant ride. So I
it
think we'll
is.
leave it with that.
Okay.
Thanks for joining me. Is there anything you wanted to add?
Nope.
Because I feel
We're
like
good.
now we're just repeating ourselves.
Okay.
But thanks for joining us, everybody, and we look forward. Please like, share, subscribe, and share with friends if you
Yes.
have a friend who's riding horses and if this can be useful to them. That's really our mission is just to help educate horse owners and help improve the enjoyment of riding your horse
Mhm.
again by helping your horse out too. So thanks for joining us and we look forward to seeing you next time.
Bye, everybody.